everybody to this webinar this evening. Quick shout out to Jennifer Weiss, Nan Kurzman, Bay Area Lyme, and Linda Giampa for all their help in getting this event actually set up. And also thank you so much to David Ewing Duncan for being our moderator this evening. David is an award-winning journalist in print, television, and radio. He has written about all aspects of life sciences, health, and technology. He is, all of our panelists are in good hands with this evening. And with that, I'll go ahead and turn it over to David.
Hey, thanks a lot, Noah. And I do want to, love the age of COVID. My Wi-Fi went down, so I'm on my phone with limited bars. So far, so good. Anyway, so hopefully I'll stay on here. Yeah, no, I'm very, very pleased to be here. And it's this topic is particularly interesting to me personally. I have not had Lyme, but I almost certainly had COVID last year and had kind of mild versions of some of the long haul symptoms. And it still crops up every so often. So very, very curious about this topic and how we're going to handle it. And what I would love to do first is introduce our amazing panel. Some of you know some of the panelists already, but would love to just give a quick shout out to each of them, and then we'll plunge into some questions and discussion. And by the way, I'm going to frame this a little bit at the top, ask some specific questions to our different panelists. And then it's a pretty quick hour here or so. And we'll try to have a little time at the end for some audience questions. And I can't really see the audience questions because of my limited technology. So we'll try to, Noah will give me cues on when you all are asking questions. So we start with Dr. Richard Horowitz, board certified internist, medical director of the Hudson Valley Healing Arts Center, scientific advisor to the Bay Area Lyme Foundation. And he's an author of How Can I Get Better? One of the most renowned researchers, physicians dealing with Lyme disease and several other things, as is Dr. Christine Green, practicing physician who's been treating Lyme disease since 1989 and has seen more than 100 patients with COVID-19, including those who have both Lyme and COVID-19. Wow. And Dr. Green also serves on the boards of the International Lyme and Associated Disease Society, the LymeDisease.org, and Bay Area Lyme Foundation. And she comes out of UC San Diego Medical School. Then we have, so those are our physicians. We have a couple of patients, if you will, who can tell us about their experiences. David Roth, and he's the executive chair of Project Lyme, and Lori Woods, Lyme disease and COVID-19 patient. I believe actually both of these people have had both diseases, which is extraordinary. And she is the founder and co-chair of the Bay Area Lyme Foundation. So a very distinguished and knowledgeable panel for this topic. And it's an interesting topic. As a journalist, I kind of want to write a story on this. I mean, it's an interesting way to think about, or at least try to find some silver linings in what's obviously a horrible and tragic situation all around, to have the double whammy of both of these conditions and diseases. And I want to start out by asking all of you, all four of you, if maybe you could give a quick answer on this idea of a silver lining. And I guess I should probably preface that a little bit by saying, in discussing this with Linda and Noah and others, the idea here is that COVID has obviously got a tremendous amount of attention. We've all been thinking about it for over a year. And the idea of having potentially some similar symptoms, helping us understand better what's going on, with this idea of long haul symptoms. Is there a way that these two diseases, we can learn from them and actually hopefully improve things for people suffering from both of them and possibly even other long haul diseases? So let me ask you all first, in your view, what is the silver lining? Why are we here tonight? And maybe start with Dr. Horowitz.
Yes, thank you, David. So I think there is a silver lining because chronic Lyme disease has been kind of debated by lots of people. Is it a true disease? It kind of reminds me of chronic fatigue, myalgic encephalomyelitis, and fibro, where people have really not, they've said, oh, people are making it up. It's in their head. And now that you have all of these long haulers that are sick with exactly the same symptoms that we're seeing with Lyme, with headaches and anxiety, depression, psychosis, seizures, chest pain, shortness of breath, muscle pain, joint pain, it basically reminds everyone of what we've seen. And basically, if you look at the inflammatory molecules being secreted in Lyme, they just happen to be exactly the same ones that we see in COVID. So all the billions of dollars of research now going towards COVID, I think it's going to raise awareness of chronic Lyme and hopefully even help our research community.
Yeah, there certainly has been, and I've written a lot about this, written about COVID and Vanity Fair and some other magazines, and just this enormous global effort. And it'd be great if we could apply that to every disease, but it has been applied to COVID, because we've been living it for the last year. And what can we do to benefit from that? And Dr. Green, what would you say to that question?
I would agree with Dr. Horowitz. And I think something interesting in Lyme is that we don't really think of it as Lyme. We think of it as tick-borne disease, as Dr. Horowitz's book so revealed. There are many, many pathogens that potentially infect the same person. What's interesting is most of those pathogens are called stealth pathogens. They infect inside the cell. A virus, by definition, has to infect inside the cell because they hijack the cell to replicate themselves. If you have an infection inside a cell, you're going to get different cytokines than if you have it in different fluids, et cetera. And so, in fact, the bacteria that we see in Lyme very much act like a virus. In fact, I had a German physician who we were having trouble communicating. When I finally said borreliosis, she said, oh, the viral bacteria. So I think the research in COVID really will inform us about Lyme. And in the community, we also hope that recognizing that there's long haul symptoms that may include long haul infection will overlap, and we'll be able to get that recognized in the tick-borne world.
Interesting. Okay. And let's go to our two patients, if you will. David Roth.
Yeah, I think we have to acknowledge just the enormous devastation that this disease has wrought, and particularly at a time where India and places like India and Brazil are being racked by this. And so I'm a little bit hard pressed to think about silver linings until this gets under control. But, obviously I echo what the doctors have said about the hope that this brings recognition that Lyme patients' long-term symptoms are real and have a biological explanation. It's not a mental disorder. And I've thought for some time that one of the reasons, and I've spent a lot of time in the business of raising money for Lyme disease research, as have a lot of people on this panel. And I've thought for a long time that one of the reasons to put money into that research is I think we'll find that the way the body reacts to that pathogen is similar to the way the body reacts to a lot of different pathogens, similar to the way there was Pandus and then there was PANS, were sort of thought of as different things, but at the end of the day, they were sort of related. And so my hope is that Dr. Green, not just the COVID research helps with Lyme, but it goes the other way, that people recognize that the Lyme research has a lot of value because of this overlap in the way the body functions in response to pathogens.
Yeah. Yeah. And then, Lori, do you have any further comments? Sorry, you're last.
Makes it more difficult.
Do you have other thoughts about this silver lining or the idea of it? And by the way, thank you, David, because it's hard to think of silver linings with such tragedy. But how can we do anything else as humans? I mean, we try to be optimistic and try to see, some positive coming out of this. So Lori, do you have any other thoughts on this kind of larger?
Just sort of ditto to what David said, as far as, well, of course, the tragedies going on in the world. But I really hope that it can go both ways. The research, the doctors, the knowledge, the treatments, the diagnostics, the whole thing can go both ways, because it is so similar. And gosh, Lyme docs have been doing this for a long time. So
yeah. And this idea, getting better recognition, having such a high profile pandemic, kind of fueling, just research into some symptoms. And I don't know, we won't have time to get into a lot of things that I've been writing about. I tend to write about things like genetics and all of that, but it'd be so interesting to do some comparisons, of different reactions, the spectrum of reactions that people have at even a molecular level. But in fact, that's my other broad question I wanted to start with before getting a little more specific with our guests. And maybe this is for the doctors. Both the doctors did a little bit of explaining this, but since many people listening here are laymen and trying to understand, the technical side of this, would you all mind describing, just for 3 or 4 minutes each, what this overlap is between Lyme and COVID? I mean, again, you started doing that, but maybe give us just a little tutorial here and why this is a phenomenon that we're interested in. And either of you could start. Dr. Horowitz, if you want to jump in.
Sure. So the symptoms that are overlapping in both diseases are including fevers, chills, fatigue, headaches, cognitive disorders, psychiatric symptoms, anxiety, depression, psychosis. We've seen it with Lyme, BART. We're seeing it with COVID, muscle pain, joint pain, chest pain, shortness of breath, diarrhea. They're exactly the same symptoms. And the reason they overlap is what I call the 3 I's: infection, immune dysfunction, and inflammation. They're seen in both illnesses. And the reason the symptoms are similar is when you look at the inflammatory molecules that are produced during COVID and during Lyme, they're exactly the same. They're called inflammatory cytokines and chemokines, TNF alpha, interleukin 1, IL-6. They're fancy names, but they mean the same inflammatory molecules we're seeing in Lyme or in COVID. And that's how I knew to use glutathione. I was the first doctor to publish on glutathione in the world literature for COVID. The article that we published has been cited over 90 times at this point in different journals. And in viral infections like COVID, they've shown that in the lungs, you need glutathione to be able to help deal with the cytokine storm, that inflammation that's happening. And we've been using glutathione in Lyme patients for 30 years to block a switch in the nucleus called NF-kappa B. So when I would give glutathione to Lyme patients with babesia, for example, their shortness of breath and chest pain and headaches and brain fog would get better. So I decided to try it in COVID patients, and lo and behold, it's worked beautifully. So the symptoms are overlapping because the inflammation is overlapping. We're even seeing POTS, postural orthostatic tachycardia syndrome, which means that you get low blood pressure because you're getting an autoimmune induced effect on your autonomic nervous system, the part of your body that controls your blood pressure, your pulse, your bladder, your bowels. So there's a lot of overlaps here. And it's mainly because the pathological process is quite similar.
Thank you. And I'd like, why don't we all go to first names here? So Christine, did you have any follow-up to that from
Would I add to that? I think that's pretty comprehensive. Symptom-wise, there's a huge overlap. Both diseases basically drive inflammation in the same way, in the same areas. I think there's slight differences in affinity. And I think what you said about genetics is important here. We're going to learn over time with precision medicine why some people get Lyme and do fine, don't even know they have it, and why some people get COVID and do fine and don't even know they have it. So the similarities are huge. I mean, it's almost a one-to-one. And I'll talk about this later, but you start adding inflammation. you start having one thing causing inflammation and another thing causing the same inflammation, and you have a cytokine storm at times. So
Yeah, and I might even add, along the lines of this silver lining, I did a big story for Vanity Fair on the genetics behind COVID, and the story was really about it's one of the the kind of spontaneous global efforts that came about, and it's called the COVID-19. Let's see, Global Consortium for the Host Organism, or something. I don't have the exact name here, but we being the host organism. And there's something like 200 biobanks around the world that have collected extensive, many times whole genomes of literally millions of people. And the bigger ones are in the US and Britain and a few other countries, but they're literally they're in some small African countries. They're all over the place. And these people within a few days joined together and took what were 200 biobanks that were separated, not really communicating very well, and put together a protocol. And they're working really diligently. Broad Institute in Boston, where I am right now, is kind of engineering this, but taking these millions of people, obviously connected to health records, including people that have had COVID, and trying to understand the genetics. And it just strikes me listening to this that we should maybe piggyback on, if there's this many similarities with Lyme, because there's never been an effort like this globally. And if these two diseases are so similar. Anyway, I appreciate that. And I'd like to kind of dive down a little bit here with the doctors first, about some of the work that you all are doing. We'd like to showcase that here, which we deeply appreciate. And let's start with Richard. And I first wanted, I know you're working on some randomized trials related to Lyme and COVID, and I was wondering if you could explain what that's all about. And, I think it follows on some of the research you've done in the clinical trials and studies. But tell us a little bit about that and what it is and what its aims are.
Well, there are two randomized trials I would like to do. One for Lyme is probably going to be put on hold for the moment if we start the one for COVID. I'm working with the University of California, Irvine right now, and we're planning on doing a randomized trial for the long haulers. And what's behind this trial is basically looking at what I call the 16-point MSIDS map. MSIDS is a model that I developed probably 15, 20 years ago, that when I was looking at 13,000 Lyme patients I've seen in the last 30 years, we discovered there were up to 16 reasons why they were ill. So there were infections, there might have been parasites, there was inflammation, there was autoimmunity, there was POTS dysautonomia, microbiome issues with the gut, mineral deficiencies, heavy metals, pesticides, mitochondrial dysfunction, hormonal abnormalities. Nobody really knows what's causing long COVID. I think some of us suspect, based on the fact that some of the long haulers who've gotten the vaccines have said, I feel better, that there may be a low-grade viral infection. And in Lyme, we know at this point, it's the biofilm and the persister forms of Borrelia, of Lyme, that are causing the most inflammation in the body. There's multiple reasons why people are sick, but these biofilm persister forms are making people very ill. And unfortunately for the Lyme community, in the last 7 years, a lot of the great university researchers, John Hopkins, Stanford, Kim Lewis, Eva Shapi at the University of New Haven, they've looked at biofilms, at persisters, and I published several studies on dapsone combination therapy. And my wife, who was sick for over 30 years with chronic Lyme, is now 3.5 years in full remission. She pretty much had every abnormality on the 16-point MSIDS map, but the thing that finally got her better was high-dose dapsone, and I published 2 articles last year on it. But for COVID, we're just going to use the same approach. The article I published in Healthcare in 2018 on these 16 factors making Lyme patients sick, we're going to do the same thing for these long haulers. And the primary hypothesis is glutathione deficiency. When you look at all of the risk factors for COVID-19, obesity, diabetes, hypertension, cardiovascular disease, lung disease, neurodegenerative, the one thing they have in common is glutathione deficiency. If you look at the literature, it shows up in all of these diseases. And what they've shown in people in the ICU with these cytokine storms is they are deficient in glutathione. They are low on vitamin C. They are low on zinc, the type of antioxidants and minerals you need to keep down inflammation. So there's a huge amount of research right now showing that glutathione may actually be one of the linchpins to get people better. And we hope to prove that in the long hauler study that we're going to be doing with UCI.
Interesting. In fact, you mentioned the glutathione study, and I know that was a pretty small study. If I remember, it was just a couple of patients, right? Tell us where you are with all that. I mean, you said you're wanting to do a study like that, but where are we on that spectrum of getting that kind of research done?
Well, right now, the randomized trial is complete written up. I've got all of the laboratories on board who've discounted tremendously. IGeneX took $1,000 off of their tick-borne panels. Precision Diagnostics took $400 or $500 off. We're doing adrenal testing for people. They took another 50 off. So it's probably going to run about 2,500 per person for 100 people to do the study. But we've pretty much got all the laboratories lined up at this point who've discounted the tests. The UCI board is on board, so it's just a question of when it's going to start. And I emailed actually one of the board members this evening to find out when we might have a tentative date to start. But even though the case studies on glutathione I published were only 2, and David knows one of them well, we've treated about 70 COVID patients with glutathione, high-dose glutathione, 2,000 milligrams 2 to 3 times per day with ivermectin, 0.2 milligrams per kilo. Not one of our patients has died. Not one of our patients has gone into the hospital on event. We do not have long haulers. We've treated about 8 long haulers from other practices. The ivermectin glutathione protocol took away every one of their symptoms. Now, it's only 8 patients, but we've had tremendous results so far with the protocols we've been using. And anyone who wants to see it, it's on my website, www.cangetbetter.com. It's under the COVID tab. You can see everything we're doing for our patients.
Now, given that a lot of people listening here now want to call you and what would you recommend it at this point, or either of you, given, it's early stages of research, I mean, you said there hadn't really, I don't know if there's side effects, but it sounds like there hadn't been any serious side effects. I mean, is there reason to wait, or what would you tell people that are listening now that would love to
about I'm sorry, Chris, just one quick thing. If it's ivermectin, there's 26 studies that have been published and 10 of them are randomized trials, and they've shown benefit. So, it's a travesty. Unfortunately, it's medical politics that the governments worldwide have not approved this. And honestly, it's medical politics. It's not medical science.
Okay.
I also think whenever you're making a decision to recommend something to a patient, you always look at the risk benefit. It turns out ivermectin is an extremely safe drug. It's a very old drug. We understand it inside and out. So in the event that somehow we're wrong, and there are good studies on it, you are probably not going to harm the patient you give the ivermectin to who does not have COVID. And the same with glutathione. Glutathione is the major antioxidant that we can manufacture. Vitamin C is stronger, but it's a vitamin, so it's a vital nutrient. We have to get it from outside of ourselves. And glutathione is known to be the major antioxidant in the lungs. There are several studies early, probably 20 years ago, with restrictive lung disease and different lung disease that nebulized glutathione took care of the patient when nothing else would. So I think it's a good question. You always have to look at the risk benefit, and you always have to present that to the patient to say, here's what we know, here's what we don't know.
Yeah, no, and I mean, some of this sounds great, and we can be enthusiastic about it, but we just have to be sure that it's safe. And in fact, I by the way, no, I can see partial when you send me things. I can only see like the first line. So, but I saw what you asked me to do, which is to ask David, who actually, and I didn't get to see what exactly he'd been treated, how he'd been treated with Dr. Horowitz. But David, maybe you could jump in and tell us, since you participated in some of what Richard is doing, maybe you could tell us what that was, and then if that helped you.
Yeah, I mean, I got sick very early. I think there were 50 people in New York when I got sick. I was first started to get sick on March 13th last year. And it was early, and I was lucky. I went to the hospital when I was starting to have breathing problems, and they didn't allow me in. So that was a good thing. And at that point, I started to work with Dr. Horowitz. And I, I kind of maybe ask him to recall exactly what I was on, but I was, at that point we were trying hydroxychloroquine, which is something that I was on when I was sick with Lyme. And so I knew that it was safe. We didn't know if it was effective, but we knew it was safe. And then I was on Alinea, I think we tried. Ivermectin was really early. We didn't go on that, but we did go on a whole bunch of supplements, including glutathione. And I actually did a bunch of IV drips during the illness that were very helpful. That included glutathione. So I don't know, Doc, you can sort of give a little more line and verse about what I was on.
No, it actually was Alinea. Before the ivermectin studies came out, and the first one just about that came out was a culture study showing that ivermectin lowered the viral load of COVID by 5,000-fold within 72 hours. But Alinea had been published years before for COVID, for the coronaviruses, and shown to be effective. So that's why I gave it to you at the time, because I had done research. But if I remember correctly, it was about an hour after you got the glutathione, you noticed that your shortness of breath and symptoms got better. And that's pretty much what we've seen across the board for people who've taken it.
I have, it's hard to tell whether I have long haul symptoms. I do have, and I only know what this is from the link that was sent out by Dr. Horowitz in advance of this, where I saw the word parosmia, the changing of the way things smell and taste. And so I definitely am continuing to suffer that. And there's a lot of things that smell sort of the same to me and kind of have an interesting, not a horrible taste, by the way, but an interesting taste. And then, I still have some fatigue and I have difficulty sleeping, but I'm not sure that it's hard to parse out where that comes from and, whether it's truly, a long haul type symptom.
Yeah, and actually, while we're talking to you, David, let's since you're Dr. Horowitz's patient, maybe just ask. You were diagnosed with Lyme several years ago. How did how did the two diseases in an actual human manifest? And could you tell the difference? Did one trigger the other? I mean, did you have any idea?
Yeah, I mean, just by way of background, I was sick in 2010 initially. I was treated by Dr. Horowitz for about a year and a half, was on antibiotics for over a year. Also was treated for Babesia, which is another bloodborne pathogen. And, that you take malarials for, and a host of supplements and change of diet and a variety of other things. And it took about 3 years to get to the sort of level that I'm at today. I did in the last, several, say 7-8 years, had a few episodes where it came back. We went on antibiotics for about a month and it sort of seemed to quell whatever issues I might have had. Along the way, I did get a panel that tested for the cytokines and chemokines that Dr. Horowitz mentioned earlier, like IL-6 and a bunch of the cytokines and chemokines. And I had pretty high levels of all of that, described by one researcher as sort of the levels that they had seen in chronic fatigue. I don't know to what extent that impacted my COVID experience, but I would suggest that they're both inflammatory processes, immune dysregulation kind of diseases. And so from the people that I know who I'm close to, I had one of the more severe cases. It wouldn't surprise me if that was a result of having an overactive immune system. I don't know if that's the right way to describe it, but having some of those long-term Lyme symptoms. I would tell you, COVID for me was much more intense at the peak of it. It was much more for like 2 or 3 days. It was pretty existential, where I felt like if I took another turn for the worse. And there was a lot of mental aspects of it because you felt like you got a little better for a day and then you got worse again, and it kind of went back and forth. And every time I got worse than the prior time. And that happened 2 or 3 times.
Yeah.
So I would tell you my experience with Lyme was probably very helpful mentally to get through it for the 15 days that I was very ill, and then the month and a half of recovery after. But for me, the intensity of COVID and the sort of that fear of the breathing piece of it was more intense. Now, I don't know how you compare that to 3 years of chronic illness and sequelae after that, but I don't know if that answers your question, David, but.
Yeah, definitely. And I don't know. I mean, did COVID feel parts of it? I mean, you partly answered this, but did COVID feel like Lyme? I mean, we're talking about the similarities at a molecular level, but how did it actually feel?
Yeah, I mean, there were parts of it that felt very familiar to me in the sense that I had, I was having night sweats, I was having trouble sleeping, I was having trouble waking up, just massive fatigue. And all of that was quite familiar. I would say during the 3 years I had Lyme, there was a whole host of other crazy symptoms that I didn't go through here, but I did, have that challenge breathing and that moment by moment, sort of fear that you have when you're, you're watching, what I was doing was, for better or worse, I was watching my, I had a pulse oximeter, so I was watching where my oxygen levels were. And, that feeling of never knowing whether, you're going to drop below 90, which is when it starts to get really dangerous, was mentally challenging in a way that was, different. Obviously, Lyme disease was incredibly challenging for the length of it and the 6 or 7 months before I knew what was wrong with me. This was challenging because of how acute it was, and just
Right.
how, how you knew that people were going into hospitals were being put on ventilators, and like 80% of them, as it turned out, doctors didn't know, but they were killing patients on some level. And so, I just felt very lucky. I did that when I went to the hospital. They asked me to speak a sentence, and when I spoke a sentence, they said, if you can speak a sentence, you can breathe enough, go home. And I was like,
Well, that's yeah, right. Acute crisis. And we actually have kind of another pairing here with Dr. Green and Lori, and maybe we'll just do the same thing we just did, if that's okay, and ask Dr. Green. You treated several dozen COVID Lyme patients, and what your experience has been, and what you've seen in terms of part of what David was saying, and then we'll hear from Lori in just a second on her experience as well, because she's your patient.
So there's definitely an overlap, but I think, David, your experience is the difference between an acute, illness and the long haul. Like if you talk to a long haul COVID patient, it would have much more overlap with Lyme. I also think that Babesia, does hurt the red cell, and so you can't exchange oxygen. But COVID kind of takes out the lung field. So it's a slightly different pathophysiology and probably a very different feeling. And anytime someone can't breathe, it's extremely scary. So the overlap that I see, I may be describing a patient that isn't Lori right now. I had a patient who got COVID in March of 2020, got over it, although during COVID, she had been well from Lyme for 7 years. And during COVID, all of a sudden her knees were swelling again, and she was achy. And then that seemed to go away. And then in November, it began to come back, and her other Lyme COVID symptoms began to come back. And it was very difficult to tell what was what. And for her, in spite of having all these symptoms, they immunized her. They advised her to get immunized. And she just plummeted downhill at that point. And apparently all her Lyme symptoms were back. What I did with her, because you can't tell, once you've got an immunization, you're going to have antibodies anyway. What I did was treat as if she had active COVID. So I used ivermectin. I also used a drug we haven't talked about, which is Xofluza, which is the new flu drug, which hits the mRNA of the flu virus. And several doctors have been trying it in COVID. And I've used it in several of my long haulers with fairly impressive results. And again, it's one of those drugs that has very few side effects. It's only a single dose. When Lori called me, she also had been well, as far as I knew, for many years. And it turns out she was, I think, at a horse show or going up to a city to see her daughter, and somehow had a COVID test before she got on the plane. This is all of our worst nightmare, arrived in Seattle, and she had had a COVID negative test earlier, but that test was positive. So many of her Lyme symptoms seem to come back. And she, for her Lyme, and you can tell this too, Lori, we did a series of antibiotics over several years, probably over 4 years, before I think you felt well enough. And you had Babesia and you had Bartonella. And so the symptomatic overlap's very much there. It's a cytokine overlap, but it's also a tissue. It's where the bug likes to go. It's called tissue tropism. Why do they both want to invade the brain and the spinal cord, et cetera? But
so, Dr. Green, could you tell us a little bit about this drug that you mentioned, the Xofluza?
Yes, it's the new influenza A drug. It could be used in the same way that Tamiflu is used, but the mechanism is different. Influenza A is also an RNA virus, and it attacks or disrupts the RNA, the genome of the virus, basically. Several doctors, and I learned this from a pharmacist who works with about 200 doctors nationwide, with their COVID patients, began to try it, even with the long haulers. And I do have another patient who has all the risk factors, over 70, obese, he has diabetes, and he had chronic Lyme, well maintained on 2 antibiotics for many years, and he got long COVID. The Xofluza, after several months of suffering, really turned him. And then ivermectin and cytokine control seemed to get him back.
Yeah, I'm curious, but I want to hear from Lori, but I want to come back to this for a minute about, you all must be aware of what the community that you're in, of physicians and scientists. I know of a lot of experimentation. It's not experimentation because these are approved drugs, and at least some of them are safe. There's research behind them, but it just seems like a moment that we've kind of been allowed to try out a lot of different things that are getting more attention than they normally would outside of the mainstream. And that might be, if you agree with that, that might be another maybe small silver lining as well, because it's been so desperate, trying to, especially in the early days of the pandemic. But Lori, I'd love to hear from you, kind of similar to David, what your experience was. And it sounds like, you did have the longer haul version of this, whereas David had a very acute version and then a bit of long haul. But maybe you could share with us, this connection. Well, first of all, what your experience was with COVID, but then what that connection is between Lyme and COVID for you.
Well, my sort of journey sounds similar to David's. I got Lyme disease, or was diagnosed with it, around 2010. And lots of other things besides just Borrelia, and lots of treatments. Dr. Green can tell you more if you're interested. But last year, I had been off antibiotics and stuff for like 3 years, like 3 years ago. And I was just trying to kind of use all the stuff I learned over the years and was kind of feeling okay, but things are kind of creeping up again as far as symptoms and stuff. But so during COVID around September, it was when the California fires were going on, and it was very close to my house, and there was a lot of smoke, and I was stressed out because I had to evacuate some things. And so I started feeling very sick, and I thought, oh darn, it's my Lyme again, but maybe I can handle this. And but it just felt like the worst flu in the world. And like all my Lyme symptoms were back. And then I didn't know this. I just thought, oh gosh, I'm going to deal with it. I had to go get a test before I went to the hospital to visit my brother because he had his kidney removed. And anyway, so I assumed it would be negative, but I got there and discovered that I tested positive. And so I stayed in this hotel for 2 weeks, and just, oh God, a week or so of just feeling all these horrible things. I was taking vitamins, all the things that, everybody was suggesting, zinc and everything. Anyway, and so I did a lot of that and resting in the hotel, and I started feeling better, maybe 5 days. And then I noticed that I couldn't smell. So, and David, by the way, I read about, oh my gosh, maybe I won't get my smell back. And I was petrified. And so I just did like the neti pot sinus rinsing like 3 times a day. And after maybe 4 or 5 days, it came back. So hopefully that might help you. But anyway, so I felt okay. Of course, I couldn't see my brother. So I went back home, and I just never kind of felt really rested. And I kind of had headaches, and the stress came back when I came home, of course, because the fires didn't burn my house, but things happened. And anyway, and so then a month or so, I started getting really bad headaches. And for the next 2 or 3 months, they ended up I was at the point where they were all the time, 24 hours a day. I was taking Tylenol 4 hours, just every 4 hours forever. And I had terrible sore throat, and I was so tired. It was like desperately tired that I called Dr. Green at this horse show that my daughter was in. And I just it was in Scottsdale and super, super, super hot, but I went to sleep in the car in the heat just because I had to sleep. So that's when I called Dr. Green, and she gave me these things, that we're discussing now. And my God, I've just felt so much better in a week. So, and, I still have lots of old Lyme symptoms, but it's not like emergency anymore. So that's what happened to me.
Did you feel like you could differentiate? Like they feel similar or same?
It did. I wouldn't have known the difference if I didn't have that positive test result. The only thing that was different, I was shocked. I didn't even know I couldn't smell. It was when Seattle finally got the smoke, and I had my window open, and in the hotel I was in, and somebody said, called up and said, hey, if the smoke is too much for you, we can put you in another room. And I'm like, what smoke? It was coming, so I didn't know. Yeah, so that was really the only difference, but never a lung issue, nothing like that.
I should ask, we're heading towards potentially, hopefully some questions from the audience, but I did maybe ask both you and David. How are you feeling now? Are you still having symptoms?
Yeah.
So you are.
You're thinking.
Go ahead, Lori.
Yeah, I'm still having symptoms. Nothing as bad as it was, though. Gosh, no, still tired, bit anxious. Stress gets me worked up. I'm sleeping pretty well. Things are better, but I'm peripheral neuropathy, memory issues. A lot of my Lyme has always been sort of the encephalopathy, memory issues, confusion. it's coming and going. It's better than it was. I can speak normally, say the words I want to say, which wasn't always the case with Lyme.
Well, if I have this right, both of you had Lyme, 10 plus years ago, or started feeling the symptoms, the long haul symptoms. You then had a period of years where you were suffering and you were treated, and I think you both said that you then kind of normalized, and then COVID came. I think that's really an important distinction. It's that the two diseases both had distinctive periods, and you had a normal period, if I got that right, in between. Just to separate out the two as having different sources, but having almost the same symptoms. I think that's a very. David, how about you? How are you feeling?
Yeah, I'm fine. I mean, I have this smelling thing, and I have a variety of things that I deal with. I think I learned during when I was sick with Lyme that I can complain, but nobody really wants to listen to me, other than the people who are part of my Lyme group. They'll all listen.
That's the truth.
But I'm okay. I appreciate it. What's that? My doc, yes, you'll listen. You'll be forced to listen. But no, I think I'm doing okay. I do have this interesting thing with smell and taste, where a lot of things smell and taste a specific way, and so it's funny. I may try the neti pot thing, although I was told it's actually nerve damage that occurs. The doctors can tell me if I'm wrong. Right. Apparently that.
Well, David, you haven't contacted me for this. You may want to try the ivermectin glutathione protocol that we've done for everyone else, because you haven't taken it.
No, I haven't taken that. I could try that.
And if it probably isn't nerve damage, if it is nerve damage, you can still get your smell back. Neuroplasticity is a very real thing, and so playing with that is good. I am hopeful. I also am part of a group who have IRB approval for a study, and in some ways it's invisible international, but it may answer some of the questions in terms of we need more data and we need bigger sizes. So what we've done is arranged a multi-centered data repository where we're going to have both community docs and academic docs contributing their diagnostics, contributing their clinical findings, contributing their treatments, and try to actually mine data to figure out what really is working. And it's a model that certainly could work. We set it up for Lyme and tick-borne disease, but it certainly could work also for COVID. Because I think all these people are out there doing things, listen to us. and it's true that our size, our study size, i.e. my practice size, I can't make definitive statements on that, right? Even though I pride myself on being a good diagnostician and watching things carefully. So I do think there's a great need for this.
Yeah. Oh, I hope that, interesting to ask you all, how that's coming along, but we're getting towards the end, and we have had a couple of audience questions that are kind of along this lines, and some of them are about, what you all, you talked about various interventions, treatments, what you might recommend, but it's had an interesting question. We've mentioned the vaccines, but would you recommend Lyme/COVID patients taking the vaccine, and is there a specific one that might be better than others? Have you had any experience with that or any knowledge on that?
I mean, I have been recommending the vaccines, the Pfizer, specifically Pfizer, Moderna, a month before the J&J and the AstraZeneca problems happened with the cerebral venous thrombosis. My concern with the technology is that adenovirus vaccine was tried in the military for anthrax, for dengue fever. It never worked. They're introducing DNA into the nucleus, which theoretically would change your genome, and you could be making spike proteins for a long time. Whereas the Pfizer Moderna, You're just getting messenger RNA into your ribosomes. You're making the proteins. Your immune system sees it. But unless you've got retroviruses in your body that are retransforming that, and that's never been proven, it seemed to me like a much safer technology. And I give people high dose glutathione, 2 grams of glutathione, a half hour after the shot to pull out the peg, because there are some people who are sensitive to the polyethylene glycol. So we've been finding that there's 3 mechanisms to block inflammation in the body. One is a switch called NF-kappa B. The way you block it is N-acetylcysteine, NAC, alpha lipoic acid, glutathione. There's another pathway to lower inflammation called NRF2. That's turmeric, curcumin, broccoli seed extract called sulforaphane glucosinolate, resveratrol green tea extract. The third one, which is in COVID, is called inflammasome activation with NLRP3, and that's melatonin that actually blocks it. So what we've just been doing is telling people to block these inflammatory pathways with, the science is good on this. There's obviously no large studies doing it for the COVID patients, but the basic science, the biochemistry is there, and it seems to at least be working. It's worked in the Lyme community for the 13,000 people I've seen, not obviously everyone, but it does work. And it seems to be helpful in COVID also. So yeah, we've been recommending the vaccines because they're saving lives. And my first job as a doctor is I first have to keep you alive. And if you do reactivate your Lyme symptoms, which probably 50% of my patients have, but usually in a few weeks, it tends to go away. And my wife, after her second shot, in fact, said she felt even better. But it's tricky because I've been avoiding vaccinations and immunizations in Lyme patients for decades, but primarily because they use thimerosal, they use aluminum, they use things that just overstimulate the immune system in the Lyme community. This is PEG. It's a little bit different, and you can pull out fat-soluble toxins using glutathione. So I think with the research that's out there, the vaccines are as safe as we can know. What we don't know, of course, is are there going to be problems years from now? But best you can do now is to save lives and do our best.
I did call Dr. Horowitz and ask about this, and he gave that recommendation. I did have the Pfizer vaccine, had both shots. I got sick for about 2 days after the first shot, and then again after the second shot.
I just had the first shot and got very sick, pretty darn sick. So
What I would say, oh, sorry.
I'm holding off on the second. I'm not going to do it.
Yeah.
I think it's all over the map, but I think in light of what David, you said earlier, 10% of the world has been immunized. That's all. 50% of the states have, but only 10% of the world. There's going to be variants. Things don't stay steady. We all evolve, and the virus evolves much faster. I think it's important for the Lyme patient to go into that shot with antioxidants, as Rich said. You can also use Benadryl. Start 3 days before. You can use Claritin. You want an antihistamine. You want a histamine 2 blocker like Pepcid or cimetidine. You want a little bit of an NSAID of some kind, or you want those supplements that will do it. And I usually give vitamin C, quercetin, because you want a mast cell stabilizer. Also, since the mast cells are those things that are degranulating and sending all those cytokines out there. So
yeah, in fact, if the 2 doctors could, I mean, there was a lot of information, and some longtime Lyme patients might be familiar with some of these. I'm sure many of them are, but if your websites, I mean, is there some place that we could get more information on, for instance, what you were just describing, preparing for the vaccine, what people, those who weren't taking notes just a second ago, is there some place that they could go to find this out? Is it on your website, or I don't know, maybe if there are a couple of really key things, you could put them in the chat for a second. That would be nice. And I think, Dr. Horowitz, that's I think you have some information on your website on what you were just talking about.
It's on cangetbetter.com under the COVID tab. And the two articles that I published in the medical literature last year on COVID, the one in Medical Hypothesis actually discusses all these biochemical pathways and the supplements. and how they work. And the glutathione article that I published in the Journal of Respiratory Medicine case reports, same thing. So you can actually read the studies that I published, but if you go to the COVID tab, a lot of it's there.
Okay.
Yeah, I want to jump in real quick, and thank you. I see Jennifer Weiss just put it in the chat as well. On our website, we are going to be uploading this video. It is being recorded, so you'll be able to rewatch and hear directly from the doctor some of their recommendations. In addition to this, we will also be sharing several of Dr. Horowitz's and Dr. Green's studies with the blog post following up this event. So anybody who may need additional information will be reaching out within the next couple of days to share those resources on the Project Lyme website. And also Bay Area Lyme has a lot of resources. Feel free to check all of our websites out. Should be able to help direct you in the right way. Thank you.
Do we have time for one quick question from the audience? Just one more for the doctors. There's been some questions about Lyme's impact on the immune system, and you all have gotten into this a little bit, but does it impact your body's ability to be able to fight off COVID? Does it make it weaken it? Does it make it stronger? How does that work?
Lyme causes immune deficiency in a bunch of people. The study I published in Precision Medicine in Healthcare in 2018, we showed 7% of that group who took dapsone had chronic variable immune deficiency. They didn't have enough immunoglobulin G, and they had subclass deficiencies, especially subclass 1 and subclass 3, which in acute Lyme goes up, but in chronic Lyme goes down. So if you happen to be a Lyme patient who's immunoglobulin deficient, you will be at a disadvantage if you're going to get these type of infections. But most of our patients that we've tested for this, they're on either subcutaneous immunoglobulins or IVIG. And of course, a lot of them are just taking immune supplements like beta-glucan raises your natural killer cells. Those are the cells you need to fight viruses. So there's a lot of studies, for example, on colostrum and beta-glucan raising the type of cells in your bodies that you need to be able to fight COVID. So a lot, at least of our patients, they're taking them right now.
Okay, great. Well, I think we're at the closing on the top of the hour. And Noah, do we have any other questions, or should we wind this up and thank everybody?
We always have more questions than we are able to answer. As always, I will go ahead and drop our info at projectlyme.org email address into the chat. If anybody has additional things that they might want to reach out to, that is always an email that you can send to. So besides that, yes, thank you so much, David, and to the rest of our panel and to all of our attendees for being with us this evening. As I said, all of these resources will be put on both the Project and Bay Area Lyme websites. So if you have any additional questions, feel free to rewatch, relook, and everybody have a great rest of your evening.
Thank you. I want to thank analysts and Noah and Linda and Bay Area Lyme and everybody else involved with this. And thank you for
David. Thank you very much to you. We take as much press as we can get, so we'd love you to write about the community all you can.
Thank you. Good night.
Good night.
Night.
Bye.